manage cancer, many of them to manage complex kidney problems, many to manage complex heart problems, and the one in Maiduguri will specialize in trauma as well. So that many of our people will not have cause to go out. And in about 2 weeks ago, we signed a memorandum of understanding with Afro-Exim Bank and King's College London to set up a center of excellence for cancer. They will be looking principally after children with cancer because cancer respects no age. It is just that we have more in senior people. And NDDC has also agreed to upgrade University of Port Harcourt Teaching Hospital and University of Uyo Teaching Hospital also for cancer care. So we are hoping that in the next 18 months, this country should have at least 10 of such facilities that can treat cancer. And then nobody will go to Gaza. You will not have to go to Ghana and pay money. You stay here. And then we'll take care of emergencies so that we will not be inundated with emergencies all the time. Next slide. Next slide. And then to look at the key elements of the successful strategy. Human resources. A facility without human resources is just a building. So we need human resources. We need to keep the human resources alive. We need to have commodities and drugs. We need to make sure that equipment, basic ones are there. We need to make sure that we get data out of the center. And then we need to communicate with our people. We need to let them know there is hope. The facility is working. Please go there. That you will survive better in the facility than outside. We know we have competitors, but we are not saying no to those competitors. We want to say, come and work with us. If you can treat any of them using our local apps, let us know. Let's work together. The first question we want to ask is, how did you make the diagnosis? Because for you to say, I've used herbs to cure cancer, I want to know how did you diagnose the cancer. We work, we are not saying no. Many of the current medications we have actually derive legitimacy and origin from herbs and many things. So we will work with our people. We are not closing our doors, but we will ask them questions, we'll partner with them to establish diagnosis, and then to establish that there is cure. Next slide. And then this is just talking about what we did in Kuchingoro. And for about 7 million or a little more than that, we were able to turn around a PAC as a proof of concept. Next slide. Next slide. That's the Kuchingoro one going through revitalization. You can see it from the top there, completely run down. So I didn't disagree with people who said some of the facilities, but this administration has started the program of rehabilitation, and we will not stop. Now we have an ambulance there to help our people. Because once they cannot look after you, then they take you to the next level. So we will make sure that we have this all over the country. This is our vision, and it will ensure that we have a system that we are all proud of. Next slide. That's Mr. President commissioning the Kuchingoro Health Facility. Next slide. And I hope you can recognize your guy there. That's why you are smiling. Then the critical steps, next slide. I will soon be done. And that's still at the Kuchingoro Primary Care Facility. Next slide. And this is the Basic Care Provision Fund, which I must also mention, because part of the reason why we are is that people are talking about the Basic Care Provision Fund. And we are actually fighting for it. And we are saying again that it would be nice to have it so that we can use it to make sure that the process of revitalization continues and that our people get a good health care. Next slide. Next slide. What we have decided to do while waiting for Mr. President and the President to put things in place and give us more money, we are kickstarting it with a pilot project in 3 states. Next slide, just click. And we are using a $20 million grant from the Global Financing Facility. Just go back a step. Yes. And we are hoping that in these 3 states, we'll be able to target 8 million people. We are kickstarting this in October. 8 million people, they will have access to maternal and child care services. And if they can do this, then we can then go back to government and say, yes, we've demonstrated that it can work. And with this, we believe that we can make a difference and demonstrate our readiness to change the narrative about health in Nigeria. Next slide. Next slide. Next slide. Just click, 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 click. Click, 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 click. And this is still talking about the expectations of our people with universal health care. And to say that we hope that we'll deliver. When we deliver that, we'll impact on many other things. We improve on SDG 6, we improve on SDG 8, we improve on 9, we improve, next slide, we'll improve on 10, 11, and 12, because we'll be creating jobs. We'll be kickstarting many others. We'll be adding at least 260,000 health workers once we move on. There will be need for commodities. We'll patronize made in Nigerian producers. So it will have a multiplier effect on the economy. And then we'll reduce out-of-pocket expenses, we'll improve health indicators, we'll create jobs, we will expand the private sector. Because in many of the countries that people go to, the private sector is also providing health. Many of the facilities in India are private sector hospitals. In US, the best hospitals are in the private sector. So we are also asking the private sector, come on board. Set up first-class hospitals, people will go there. It is not just for government. Government must work within government, federal, with state and local government, and we must also work with the private sector and deliver it to our people. Next slide. And then we said we're also working on the Rapid Result Initiative, where we've provided help to poor people. And we started last year, we'll continue this year. We are giving free surgery to poor Nigerians. If you are poor, you have no job, you are less privileged, we will take care of you free of charge. Free surgery if you are in this category. But we will verify that you are truly poor. We don't want a rich person to say I'm poor. Next slide. And then we have the Save 1 Million Life, which is ongoing at the States. Next slide. Moji, I'm almost done. Next slide. And then I've spoken about the 7 centers of excellence. Next slide. And then what we are doing across the state, that's Borno State, that is down there is Niger. Next slide. Go on. Just go on. We've supported other countries. Next slide. Next slide. We've been free of polio for over a year. We're working with the National Assembly. We have commitment of National Assembly. They said if 1% is in the budget, they will protect it. So we are looking forward to that, to the fulfillment of that pledge. Next slide. And then the media, we want you to partner with us. We can't do it alone. Speak for us. And then, please, let the states know that they must also complement the federal. Next slide. And then to thank the organizers, to say that we appreciate you. Next slide. And I think I'm done. Thank you.
Thank you very much, Honorable Minister. I couldn't stop him, and it all sounded like an inaugural lecture, but one that took us through the whole ramification of healthcare delivery service. Spoken to projection, he's spoken to progress, he's spoken to private-public practice together, spoken to investment in health and roles and responsibilities of states, local governments, and indeed individuals, and of course, rapid response and sustainability in healthcare delivery. Thank you very much, Honorable Minister. We're still on at this first inaugural health dialogue put together by stakeholders as listed behind me there. At this juncture, Your Excellency, Honorable Minister, Executive Directors here present, Permanent Secretaries, Honorable Commissioners from the states, CMDs, MDs, development partners, friends, participants, and of course the media that is partnering with the health institutions and health organizations in Nigeria to ensure that health becomes an investment for growth in Nigeria. It is on your behalf that I'd like to invite His Excellency, the Vice President of the Federal Republic of Nigeria, ably represented by the Director General, Voice of Nigeria, Mr. Osita Okechukwu, to deliver the VP's address.
Honorable Minister of Health, Professor Isaac Adewale, the Executive Director, NIPDC, the primary headquarter of the country, Dr. Fazel Shaibu, the Executive Secretary, Acting Executive Secretary of National Health Insurance Scheme, the DG of NACA, and other heads of other government agencies here. The representative of the Emir of Kano, diplomats here, the representative of the Bill Gates Foundation, a foundation that has been very useful to the country over the years. May I, on behalf of the Vice President, Professor Yemi Osibanjo, SN, GCON, who actually wanted to be here, but further exigencies, to thank the organizers, especially Jakpo of the Premier Times and his group, and other stakeholders. Because anytime we talk about health, it brings us back to the fact that the foundation of health is the foundation of life. It brings us back to the fact that health is wealth. And I'm also happy with the Minister of Health for taking us memory lane of what this administration had done. Because a lot of Nigerians most often forget that this is an administration that came when there was plunge in the oil prices. A plunge that kind of offset all that we have recorded that we were about to do, especially when the savings from the bounty years of the oil sales were not less than transparently kept. But at any rate, the minister was able to tell you where we're coming from the federal government side. And a lot of Nigerians do not believe that President Muhammadu Buhari, with the few funds he made in the coffers, looked at the books and found out that some state governments did not pay salaries and pension arrears for up to 18 months. And when he was confronted with this challenge, the first thing Mr. President said is, yes, nobody might even notice that we're trying to take care, but he remembered and told us that, one, if we do not pay those salaries and pension arrears, yes, there was an argument that the civil servants being owed were not more than 10% of the population of the country. But Mr. President said no. That there are others, like the tailors, the provision traders, that are being owed by these civil servants across the country. And that if you don't pay pensions as well, all the war we're waging on anti-corruption will be nil. Because those who are serving, anytime they see that those who have left were not taken care of, the tendency is that we're telling them to take care of themselves. So as the Honorable Minister said, for us, health is comprehensive. Comprehensive in the fact that if you do not invest in food security, an angry man is also in danger of being afflicted by one disease or the other. So it's not just that we're not investing more on health. We intend to do so, but we met deficit infrastructure that made Mr. President to go around the whole world and was able, through the Eurobond, the African Development Bank, the Chinese Exim Bank, was able to carry a lot of loans. But unfortunately for us, for the past 12 months, these loans are also held. Honorable Minister, you did not remember to allow them that in that because we also want to stop the medical tourism. We want to, just like we're trying to stop the also trying to stop the medical tourism. Because we know how exorbitant it is, and we also know that it's a drain on our foreign reserves. We're also talking about health. When Mr. President reassured the country that everybody has the inalienable right to live anywhere he wants, what is he trying to do? He had recorded a real peace in the minds of a lot of Nigerians. That's why we're saying that hate speech should be regarded as terrorism, because it leads to hypertension. A bad speech somewhere might cause somebody hypertension somewhere. So we're appealing to our citizens that we have to be decorum in our speeches. You do not just say whatever you want to say because you have freedom of speech, because the other man might feel anxious that is not necessary to have been in any way afflicted with. So we are preaching as well that while we are investing in health, we also are looking at health as a comprehensive aspect, because most of the roads abandoned for 5-6 years ago, Mr. President said, let us not award new contracts. Let's call back the workers. And if you know the number of workers that are back to work, with the little meager resources we found on the table, so the trademark of Mr. President is with little fund, he had done more than the previous regimes with more funds. So we are committed to providing health services for the country. As the minister said, we're also pleading with other tiers of government, both at the local, state level, that they should also pay attention to what we are doing. Thank you very much, and have a nice discussion.
Thank you very much, representative of His Excellency, the Vice President of the Federal Republic of Nigeria. Well, we've heard it there. I think the dialogue can continue in earnest. We've heard from the Health Minister, we've heard from the Vice President, and we should now start taking our notes as we're going to go into plenary after a very short break. First, we're going to have a group photograph outside there at the entrance of the hall here. After the group photograph, we're going to take about 20 minutes off for tea break, and we'll resume panel discussion after 20 minutes. I want to thank you, the Honorable Minister, representative of His Excellency, the Vice President, representative of the Emir of Kano. The photographs will be with the key partners here present. And at plenary, I have two of my friends who are going to be manning the microphone. We have Gloria. Please, I'm sure you met Gloria earlier, and of course, Ambassador from the National Assembly. Please, can you both be upstanding and take a bow? They will be manning the microphone at the plenary. And I do hope that the concentration and commitment that we've shown at the formal opening will prevail throughout the next 48 hours. We would please go out now after the national anthem, please, after the national anthem for the group photograph and indeed the tea break. Thank you all, and God bless this dialogue. request that we upstanding while the dignitaries will take leave of us. Please, all partners are requested to be. Please, let's take it outside because of the reflections here.